Hi everyone, I am Dr. Dixit Garg and I'm working as a consultant intervention cardiologist in Manipal Hospital, Palam Vihar, Gurgaon. Today we are going to discuss the management of hypertension guidelines as per RSSDI recommendations 2022. So hypertension and diabetes are two of the leading lifestyle diseases in India and Southeast Asian population, and it often coexists due to overlapping pathophysiological factors like obesity, insulin resistance, inflammation, and oxidative stress. Up to 50% of hypertensive cases in India are diagnosed with type 2 diabetes mellitus. The recent RSSDI guidelines 2022 provide a comprehensive guideline for management of hypertension in these patients. As per these guidelines, hypertension is defined as systolic blood pressure of more than 140 mmHg and or diastolic blood pressure of more than 90 mmHg. Primary hypertension is mostly asymptomatic, while secondary hypertension is due to various underlying pathologies. Uncontrolled blood pressure, despite the usage of three antihypertensive drugs, is referred to as resistant hypertension. Now, primary hypertension is essentially idiopathic condition, which means that we do not know the cause of the reason of rise in blood pressure in more than 90% of the patients. By secondary hypertension, we mean that there is some reason for rise in BP. Like there may be a problem with the arteries of kidneys, which is called renal artery stenosis. There may be condition called arteritis, in which all the big vessels of the body are affected, medium and large vessels are affected. There are some congenital problems as well too, like coarctation of aorta, which can lead to rise in blood pressure, and valvular conditions like aortic regurgitation. So these are some of the correctable causes of hypertension, which are essentially called as secondary hypertension. But going back to the main point, which is the primary hypertension, that means in 90% of the patients, we do not know the reason of rise in blood pressure. Now, over 1 billion people suffer from hypertension globally, and it is expected to go up to 1.5 billion by 2025. So you can see the magnitude of the problem and the rapidity with which it is rising. Up to 50% of the cases are also diagnosed with type 2 diabetes mellitus. And hypertension, if it is not controlled, then it can lead to a lot of end organ damage, a lot of complications like cardiovascular diseases, kidney disease, peripheral artery disease, retinopathies, and the cerebrovascular accidents. There is a complex cause-effect relationship between hypertension and diabetes, which predisposes these patients to increased risk of these complications. For patients with diabetes and hypertension, a 24-hour ambulatory blood pressure monitoring is recommended to maintain blood pressure targets of 130 mmHg. The use of an aneroid sphygmomanometer must be preferred over digital devices. However, digital devices may be preferred for home-based monitoring. Blood pressure thresholds may vary with age and comorbid conditions, so regular follow-up with your treating physicians is a must. Non-pharmacological management of hypertension in diabetes patients, it includes low sodium diet, increase in physical activity, increase in water intake, refraining from substance abuses like smoking or alcohol, and weight reduction. With non-pharmacological management, we can expect the blood pressure to decrease by 15 to 20 mm of Hg. But it requires consistency and motivation because the effects will not be available, will not be visible before 5 to 6 months. So it requires a lot of dedication and perseverance on the part of patient. Coming to the pharmacological management, there are a lot of drugs which are available to control the blood pressure, but more than 90% of the patients, 3 or 4 drugs are the first line therapy, and we choose these agents depending on the patient profile. So one of the class is ARBs or ACE inhibitors. Now they are the choice of therapy, and often it is combined with calcium channel blockers to manage blood pressure effectively. So the next class of drug is a calcium channel blocker. There are a lot of molecules available, but recently cilnidipine has been recommended for its renoprotective benefits as well. So kidney protective benefits as well. Now combinations of ARB with thiazide like diuretics, they reduce risk of renal disorders. Now, while telmisartan can be a first line of ARB for treatment of diabetic hypertension due to its beneficial effect on fasting blood glucose and insulin levels, but alternatively, azilsartan with a similar safety and efficacy profile is also recommended. Thiazide like diuretics can be preferred in elderly patients with existing CVDs. ACE inhibitors may be used as an alternative to ARBs for CVD risk reduction in high-risk patients. Now, beta blockers may be preferred in patients with a previous history of CVD and as an alternative to RAS blockers in pregnant women. To summarize, blood pressure hypertension is a strong and modifiable risk factor for microvascular and macrovascular complications of diabetes. There is strong evidence from clinical trials and meta-analysis which support the maintenance of blood pressure target to less than 140 by 90 mmHg in most adults with diabetes. Lower blood pressure targets may be beneficial for selected patients with high risk of cardiovascular disease if they can be achieved without any complications or side effects. And these targets may be considered on a case to case based on the patient profile. In addition to lifestyle modifications, multiple medication classes are often needed to attain blood pressure control. So, a regular follow up with the treating physician is a must. It is advisable to keep a track of blood pressure at home using digital based devices, although they are not very accurate. However, they give us an idea of the trend of the blood pressure patterns, and it helps us to titrate the dose of the drug. Of course, you can verify these findings whenever you visit your physician, but home monitoring is highly recommended. And a few more lines that I would like to add regarding the non-pharmacological management of blood pressure is the reduction in salt intake. So the recommendation is to consume less than 5 grams per day, but our Indian diet typically contains more than 11 grams of salt intake per day. So it's almost double the recommended dose. So to cut down on the extra salt, we can reduce sprinkling salt on curd, salad, fruits, or decreasing the use of chutneys, achars, pickles, and papads in our daily, dietary habits. Also, some people are very fond of having some namkeen bhujia or samosas, a variety of namkeens with their tea and coffee. So that also can be cut down. So these are the ways in which we can reduce the salt intake. Coming to the recommendation regarding the water intake, we should consume at least 1 liter for every 20 kgs of body weight. So if you are about 80 kgs of body weight, the fluid intake must be 4 liters per day. So regarding the activity levels, the recommendation is to do a moderate intensity exercise, which may be your cycling, swimming, or jogging, brisk walking. So these kind of exercises should be done at least for 30 minutes, at least 5 times a week. Now, about the substance abuse, we must completely refrain from smoking and cut down on the alcohol intake. And getting adequate rest is also equally important. So in today's lifestyle, due to work pressure, due to globalization, people work in different shifts, including night shifts as well. So the whole circadian rhythm is disturbed, and people do not really get to adequate rest. So adequate rest, getting adequate sleep hours is also very essential. So in case the commutation time is also should be cut down. If you're traveling very far from your home for work, then again it adds to increasing your stress levels and less time for yourself in terms of physical activity. So adequate rest and decrease in travel time should also be stressed. So with that, I would like to take your leave, and we will get back with more such information regarding various cardiovascular problems. Thank you.